Dr. Mike, I read that certain everyday activities can actually harm our vision. Can you explain more about this?
Absolutely, Sarah. One of the key activities that many of us do daily, which can negatively impact our vision, is excessive screen time. Our lives are increasingly centered around digital screens, computers, smartphones, tablets. Spending too much time staring at them can lead to what's commonly known as digital eye strain.
Digital eye strain? What exactly happens to our eyes when we look at screens for too long?
Good question, Sarah. When you look at a screen for an extended period, your blink rate tends to decrease, which can lead to dry eyes and irritation. Furthermore, focusing on the close-up text and images may cause eye fatigue and blurred vision. In some cases, it can even contribute to long-term issues if not managed properly.
I've definitely felt my eyes get tired after long hours on my laptop. What can someone do to prevent this?
One effective method is the 20-20-20 rule that I recommend. Essentially, every 20 minutes, you should take a break for at least 20 seconds and look at something that is 20 feet away. This helps reset your focus and gives your eyes a much-needed break.
That sounds doable. Do these breaks really make a difference?
They do. These short breaks help in reducing the strain on your eye muscles. Think of it as giving your eyes a mini workout break. You wouldn't exercise the same muscle continuously at the gym without resting it, right? The same principle applies to your eyes.
Makes sense. I'll start implementing the 20-20-20 rule. Thanks, Dr. Mike, for the insightful advice.
You're welcome, Sarah. Remember, taking care of your eyes today plays a crucial role in maintaining your vision as you age. Keep those breaks consistent.
Dr. Mike, moving on from screen time, I've also heard that lighting can affect our eyes. Is there a right way to set up our lighting to protect our eyes?
Absolutely, Sarah. Lighting is incredibly important when it comes to reducing eye strain. Ideally, you want your environment to be well lit, but not overly bright. Too much contrast between the brightness of your screen and your surroundings can put additional strain on your eyes.
So, how should I adjust my lighting at home or at work?
A good rule of thumb is to use ambient lighting that doesn't create glare on your screen. Natural light is the best, but it's not always available. You can use soft white LED bulbs in your room, which provide good illumination without being harsh. If you're reading or working at a desk, an adjustable desk lamp can direct light exactly where you need it, which helps avoid glare.
What if I'm working late at night? Should I use the same lighting setup?
At night, you want to minimize blue light exposure because it can interfere with your sleep cycle. Many devices now have settings that reduce blue light in the evening. As for your room lighting, using a dimmer light can help, but make sure it's still bright enough to prevent straining your eyes from low light.
And what about when I'm reading a book? I like reading in bed before sleep.
When reading a physical book, it's important to use a focused light source directed on the pages, rather than lighting the entire room brightly. A small reading lamp that clips onto your book or stands on your bedside table will allow you to see clearly without overwhelming your eyes right before you sleep.
These tips are really helpful, Dr. Mike. I didn't realize how much lighting could affect our eyes.
Yes, it's often overlooked, but proper lighting is key to keeping your eyes healthy and reducing fatigue. Just small adjustments to your environment can make a big difference in how your eyes feel at the end of the day.
Dr. Mike, we've covered screens and lighting. I'm curious about the role of diet in eye health. How does what we eat affect our vision?
That's a great question, Sarah. Diet plays a crucial role in maintaining overall eye health and function. Certain nutrients are particularly beneficial for your eyes, including omega-3 fatty acids, lutein, zinc, and vitamin C and E. These help protect against damage and can reduce the risk of age-related vision problems.
Can you give examples of foods that contain these nutrients?
Certainly. Omega-3 fatty acids are abundant in fish like salmon and sardines. They help combat dry eyes and are good for the overall health of the retina. Leafy greens like spinach and kale are rich in lutein and vitamin E, which can help protect against cataracts and macular degeneration.
What about snacks? Any healthy options there?
Nuts and seeds are excellent snacks that provide vitamin E, which helps fight off oxidative damage in your eyes. For a good source of zinc, you can turn to oysters, beef, and pumpkin seeds, which help with night vision and the health of your retina. For vitamin C, citrus fruits, strawberries, and bell peppers are your best bet. They contribute to healthy blood vessels in your eyes.
It sounds like a balanced diet can really benefit eye health. Are supplements necessary if I'm eating right?
If you have a well-rounded diet, you might not need supplements. However, some people might need an extra boost, especially if they have dietary restrictions or specific medical conditions affecting nutrient absorption. It's best to consult with a healthcare provider before starting any supplements, especially since they can interact with other medications.
That makes sense. It's amazing how much what we eat affects different parts of our body, including our eyes.
Absolutely, Sarah. Good nutrition is foundational, not just for your eyes, but for your overall health. Making conscious choices about your diet can have long-lasting impacts on your vision and quality of life.
Moving on to our next point, Dr. Mike, how important is eye hygiene for maintaining good vision?
Eye hygiene is extremely important, Sarah. Simple practices can significantly reduce the risk of infections and discomfort. For instance, one of the most common habits that people have is rubbing their eyes. This can transfer bacteria and other pathogens from your hands to your eyes, leading to infections like conjunctivitis.
What are some best practices for eye hygiene then?
First and foremost, avoid touching your eyes with unwashed hands. Always wash your hands thoroughly with soap and water before touching your eyes or handling contact lenses. Speaking of contacts, it's crucial to follow proper care instructions. This means using appropriate solutions for cleaning and storing them and replacing your contact lens case regularly.
Are there other things to consider for those of us who wear makeup?
Definitely. If you wear eye makeup, you should be careful about keeping your products clean and discarding them according to their expiration dates. Bacteria can build up in products like mascara and eyeliner, leading to infections. Also, never share your eye makeup with others.
I've seen some advice about screens and eye drops. Should we be using them regularly?
Eye drops can be beneficial, especially if you suffer from dry eyes. However, it's best to use them under the guidance of an eye care professional. Overuse of certain types of eye drops can actually irritate your eyes further. If you find yourself needing them frequently because of screen use, it might be a sign to revisit how you manage screen time and ensure you're blinking enough.
These are helpful tips, Dr. Mike. I'll definitely be more mindful about my eye hygiene from now on.
That's good to hear, Sarah. Simple hygiene practices can have a big impact on your eye health. Keeping your eyes clean and avoiding unnecessary contact or irritation goes a long way in maintaining good vision.
Dr. Mike, we've covered a lot about protecting our vision. What about regular eye exams? How often should we get our eyes checked?
Eye exams are essential, Sarah, even for people who think they have perfect vision. Regular checkups can detect early signs of conditions like glaucoma, cataracts, and macular degeneration before they become more serious. For most adults, having your eyes checked every 1 to 2 years is recommended. However, if you have specific risk factors or a family history of eye issues, you might need to go more frequently.
What happens during an eye exam?
During an eye exam, an optometrist or ophthalmologist will not only test your visual acuity to determine if you need glasses or contact lens prescriptions, but they will also examine the health of your eyes. They use special equipment to look at the structures inside your eyes to check for any potential problems.
Can these exams help even if I don't have any symptoms?
Absolutely, Sarah. Many eye diseases don't show symptoms in their early stages. Regular eye exams are key in catching diseases early when they are most treatable. This proactive approach can help maintain not only your vision, but also your overall quality of life.
That makes a lot of sense. I'll make sure to schedule regular appointments. Thanks for all the great advice today, Dr. Mike.
You're welcome, Sarah. I'm glad I could help. Remember, taking care of your eyes is an important part of your overall health care. Stay proactive and you'll enjoy the benefits of good vision for many years to come.
I definitely will. Thanks again.